This patient came to see me about 10 months ago regarding tooth number 14. Patient said tooth hurt to hot and cold and biting, and he had some achiness as well. So I examined the tooth, evaluated the tooth, and my diagnosis was irreversible pulpitis with acute apical periodontitis. So I recommended root canal. And the patient was supposed to schedule an appointment with us. Well, he never did. And let me show. Here's the date. As you can see, about 10 months ago when he came to see us initially, he never scheduled an appointment. He came in for a consult a few days ago for the same tooth. He said, well, the reason I didn't schedule 10 months ago for endodontic treatment is a few days after I saw you, the pain went away. So I said, oh, I figured, yeah, the tooth, it was probably just a fluke, and that, I don't need the root canal. But now suddenly my tooth is starting to hurt again, and it hurts a lot. So tell me what's going on now. So we took some radiographs, of course. Tooth was tender to percussion and palpation, and as you can see, now there's a periapical lucency associated with the tooth. So I told him, I said, well, I told you had the diagnosis 10 months ago was irreversible pulpitis. You needed a root canal. So what happened was that the nerves, the pulp tissue died, and now you have an abscess tooth, you have an infection. So patient said, okay, I'm sorry, now I'm ready. I should have gotten the root canal 10 months ago, but let's go ahead and do it. Well, the thing is that with him waiting, now the success rate has dropped. The success rate for the root canal with the vital pulp 10 months ago, if we had done it, would have been more than 90%. Now the success rate is 80% and more. 10 months ago, when the pulp tissue was vital, would have been 90% and more. Anyways, I told him, and he said, let's go ahead and do it. We got to do what we got to do. Calcified, as you can see, calcified canals. I can't even see the canals, and when I accessed the tooth and then I accessed through the PFM crown, no pulp chamber. So these are the teeth that if you're a general dentist, you need to avoid. You need to be able to read x-rays and refer these cases out. You don't want to struggle with this case. You don't want to go through a PFM crown. No pulp chamber to hit. So canals, you got to use a microscope and be able have the knowledge to know where to look for, what to look for, be able to read the pulpal floors map. There's a map there. You need to be able to read that map. If you can't read that map, you don't have magnification, you don't have experience, expertise, knowledge of the anatomy of the tooth, then you will surely fail, and you will make our jobs as endodontists, you make our jobs really tough now, because now you've cleaned out, removed all the geography of the pulpal floor that we could have used if we had access to tooth endodontically and worked on it. Anyways, take a look. So we went through the PFM crown, and here's the post-op. 4 canal systems, MB1, MB2, distal buccal and palatal. We did this, of course, in one appointment. As you can see, everything went beautifully. I was worried before I started the endo that I may not even be able to locate all the canals, and I discussed that with the patient. But as you can see, we were able to do this root canal properly, and everything went great. We went ahead and temporized the tooth and referred him to his dentist for a permanent restoration. Cases like this, I don't recommend a crown right away. I just tell the patient, replace the temporary filling with a permanent filling for now. Come back and see me in 6 months. If we tell you that the infection is gone and we have radiographic evidence of that, and you don't have any symptoms, then if you want to get a new crown, go ahead and get a new crown then. But for now, just have your dentist replace my temporary filling with a permanent filling. But as I said, everything went beautifully, as you can see. Case selection. Know which cases to attempt and which cases to refer out if you're a general dentist.